Hi everyone, this is Dr. Hall. Today we're going to do the clay modeling of the anatomy of the breast. So to get started, I have a pectoralis major muscle. So here is my sternocostal head, here is my clavicular head, as if the person's head is up here. This is the attachment out to the humerus. So this is medial here, this is lateral, this is superior, this is inferior. So I've already gone ahead and shaped the pectoralis major muscle. You can also see the fiber direction of the muscle, which is really important because it tells you in which way the muscle shortens, which tells you the actions of the muscle. So the next thing we're going to add for the breast is actually the deep pectoral fascia. And what I'm going to use here is a piece of a plastic bag. So fascia is a tough covering over the surface of the muscle. So you have your deep pectoral fascia. And then, I should have cut this, but then there's a little potential space in between the bottom of the breast and the top of that deep pectoral fascia. And that is called the retromammary bursa. Retro means behind, so this is behind the breast. Mammary as in mammary glands as in breast. Bursa is a pocket of fluid, and this is kind of what we call a potential space. Usually there is nothing in this space. Usually it is collapsed and empty, but it is a place where there aren't a lot of connections coming through, so it's pretty easy actually to get into that area. So now we're going to actually build the breast itself. So I have some mammary glands, also called alveolar glands. Ooh, my retromammary bursa is making this a little bit difficult. You might say, how are these things supported? Well, they're supported by adipose tissue. And in fact, I'm going to just do a cross section of a breast here. And in fact, the major determinant of breast volume and shape is the amount and distribution of the adipose tissue. So you can see I'm being pretty generous with my adipose tissue here nestling in the mammary glands among that. Let's see, I've got one more here. Okay. And then we're going to also have some extra adipose tissue around. So not only do I have adipose tissue to help support the mammary glands, but I also have some ligaments called suspensory or Cooper's ligaments. And these are going to extend from that deep pectoral fascia all the way up to the skin, which I haven't added yet. Right? So we're going to have these Cooper's or suspensory ligaments coming up and attaching ultimately to the skin. These are those ligaments that with time and age kind of wear out a little bit, and so the appearance of the breast changes over time as female-bodied people age, and these ligaments kind of get stretched out. So this is looking pretty strange, but that's all right. So we've got our mammary glands, we've got our adipose tissue. Now we need to add the ducts that the milk is going to come out of. So each mammary gland has a lactiferous or alveolar duct that leads out from it. Okay, so each one of these gets its own alveolar duct or lactiferous duct. The important word there, because both terms get used, the important word there is duct. So I'm going to attach my lactiferous ducts to each of my alveolar or mammary glands. And what these ducts do is they end up coming together and forming a bigger tube, and that bigger tube there is then called the lactiferous sinus. Let me add a duct, and this one will join into that sinus as well. Okay, so that is what the interior of the breast actually looks like. So I'm going to add some skin just for reference. Let's see how this goes. And then we're going to add some of the superficial structures of the breast. So I've got an areola, which is that darkened, pigmented skin in the center of the breast. So here's my areola. And then, of course, the nipple. And the nipple is where those lactiferous sinuses are going to then come to the outside, right, to deliver the milk to the nursing infant. The areola itself is just some pigmented skin, but it has some interesting structures called Montgomery glands, which I'm representing with these little tiny pink beeblies. And Montgomery glands secrete a moisturizing substance for the areola, which is really important because otherwise it'll get chapped as the baby nurses. So we have a few more structures still left. One is lymph nodes. So interestingly, most of the lymph nodes that drain lymph from the breast tissue are going to be found out in the axilla. So I have these little purple guys out here. Most of the lymph nodes for the breast are going to be out in the axilla. Sometimes there are some toward the sternum as well, but most of them are going to be out in the axilla. So we've done almost all of our structures except for two, and I broke my own rule and I didn't start with the deepest structure. So those two are the blood vessels that supply the tissue of the breast. So there are two arteries that supply the breast tissue with its blood flow, and you've already learned one of them, the lateral thoracic artery. So you might remember the lateral thoracic artery. We studied the pectoral region. It comes down the lateral aspect of the pectoralis minor. So I'm going to sneak it underneath here because it would of course then be deep to the pec major. And you might remember the lateral thoracic artery is coming off of the axillary artery, and it's going to send branches that come through the pec and supply the breast. The other artery that's going to supply the breast tissue is the internal thoracic. So this one is going to be located medially on the medial aspect of the breast, deep to the rib cage actually, and it's also going to send, I'm going to move my skin out of the way because that's pretty superficial. It's also going to send branches to supply the breast with arterial blood flow. So let's go ahead and review our structures. We have superficially the skin, the areola with its Montgomery glands, the nipple. We look inside the nipple, we see the alveolar or lactiferous sinuses, those coming together, those larger tubes holding milk, which collected milk from the lactiferous ducts, which came from each mammary gland, also called alveolar glands. We have adipose tissue distributed throughout the breast tissue. A lot of times in diagrams it looks like it's only around the outside, but it's actually distributed throughout. I'm going to get rid of my nipple there. We have Cooper's or suspensory ligaments. We have our internal thoracic artery with branches to the breast. We have our lateral thoracic artery with branches to the breast. Our lymph nodes out here mostly in the axilla. We have our retromammary bursa, that potential pocket, deep pectoral fascia, and the pectoralis major muscle. So that's it for breast anatomy.